Good morning, Dr. Katzen.
Good morning.
How are you today?
Good, and yourself?
Awesome. So today we're talking about neck liposuction.
Neck. Okay, good.
All right, so we know you just wrote a blog about this. Can you enlighten us on what neck liposuction is?
Basically, neck liposuction is removing fat from the neck. When we do liposuction, as its word indicates, lipo is fat, suction is removal with suction. So we create a small little incision just behind the chin and suck out the neck fat.
All right. Is that the same thing as a neck lift?
No, neck lift is different. So when we're doing a neck lift, typically what we're going to do is make an incision in front of the ear here like a facelift and go slightly behind their ear here on both sides, and that allows us access to the lower 2/3 of the face and the neck. And then we go in there and we sew up the platysma muscle, that's the muscle deep underneath the skin, and then also lift up the neck through this facelift incision. So that's a neck lift where we're removing fat and primarily skin to lift that neck up. So the neck lift with the incision around the ear is a lot more invasive than neck liposuction.
And how do I know if I'm a good candidate for a neck liposuction or if I need a neck lift instead?
Yeah, that's where you got to come into the office and see a board-certified experienced plastic surgeon for evaluation. Sometimes you can get by with neck liposuction. Sometimes you really need a neck lift.
All right. Are there certain traits that you look for in patients that you would say, no, you actually need neck lipo, or no, you need a neck lift?
Yeah, so for older patients, maybe over like 50, 55 years old, maybe have a lot of sun exposure, radiation damage to the skin, those patients probably would do better with a neck lift. Younger patients, maybe they've dropped a lot of weight, 100 pounds or more, may be more amenable to just neck liposuction.
So here we're talking about skin quality, right?
Exactly. It's the ability of that skin to snap back after the suction and adhere to the undersurface of the chin. And you got to imagine, think about the anatomy of the area. It's an area of overhang and it's defying gravity, And it's defying gravity, every second of the day, and it's trying to suspend that area, but over time it just weakens and elongates.
Let's talk about this patient that we see on the screen. A lot of times people would look at her and not assume that neck lipo would be enough.
Yeah, so this was an older patient in her late 60s, and she really didn't like her neck. But her chief complaint or her chief requirement was she said she did not want a neck lift, she did not want an incision around the ear. All she wanted was neck lipo, and she'll deal with the loose skin, but she just wanted neck lipo. So we did neck lipo, and I think it came out really well on this patient. I removed about 2 liters of fat, about 1 liter of fat from each side of the neck. We did this under general anesthesia. She conscientiously wore her neck garment afterwards, and as the French say, voila. Here we have a nice thinned out neck. Not 100% perfect, but it is less invasive, less downtime, less pain than a neck lift. And I think she has excellent results considering that this is just neck liposuction, no neck lift involved.
And even though she does have that little bit of skin, you could see her jawline so much better.
Yeah, again, you can see her inferior jawline here, or mandibular line here, and look at that more chiseled neckline, more of a 90-degree angle right in there. Here you couldn't even see the angle because of that large turkey gobbler.
Yeah, I think she looks like 10 plus years younger.
Oh, yeah, at least. And most important thing is the patient's extremely happy with her results, and she didn't require that more invasive, again, neck lift.
One interesting thing that you talk about during your neck lipo procedures is how the skin in there becomes stickable. Can you talk about that?
Yeah, so when we go in and we do liposuction, we're basically interrupting that area from the skin, the deep skin, to the connective tissue or the fascia underneath. So in order of anatomy, the layers are the skin, the fat, the fascia, that's that thick layer on top of the muscle. And in this case, we have the neck skin, we have the neck fat, we have the fascia, and the muscle deep underneath there is the platysma muscle. So when you sort of do one of those, that's the neck muscle that you see, the platysma. Some people call it the frog neck muscle because you got the muscle that adheres the lower end of the mandible here down to the clavicular bones in this distribution. So what we're doing is we're removing that layer of fat between the skin and the fascia. So when you remove that layer, the body is always trying to get rid of empty cavities or holes, so it's sticking those areas down. So when we remove that fat from the neck, that area of skin becomes more stickable and it wants to stick down to that fascia. So you have to tell it, stick down in that area, and we achieve that with a garment. That's why the neck garment is so essential in my practice after neck liposuction.
So this patient on the screen is in her late 40s, and she wanted neck liposuction. She also didn't want a cut.
Exactly. So a lot of patients present to my office, and the first thing they say, even before they show me their issue, is that they do not want an incision around the ear. They do not want telltale signs of a facelift. They don't want the face pulled too tightly. They don't want the neck pulled too tightly. They want natural results. So on this patient, we offered her neck liposuction. She's very happy with the results. A lot of the times you can achieve the neck liposuction solely by making an incision around the chin here, about the size of a pencil eraser, a little bit smaller, and we just do sweeping neck liposuction in there. When we do neck liposuction, we put tumescent fluid in first. That allows the area to minimize the pain with the lidocaine, minimize bleeding with vasoconstriction due to the epinephrine. And then we usually insert the vaser in there to help melt the fat, and that helps to also make that skin more stickable. And then we use this cannula or the straw to carefully aspirate or remove just the fat in the neck. You can sort of see that there's sort of 2 or 3 areas, depending how you look at it. There's this area just directly centrally underneath the chin right there, and then there's the area laterally here underneath the mandible, sort of on the sides. So you can have 1, 2, 3 areas, or sometimes plastic surgeons break it down into 2 areas, centrally and laterally here. So centrally we can get it with that incision around the chin. We can usually get that central area and a little bit of the lateral area. If it's not too much on the lateral area, we can get it all with that one incision. But to get that lateral area, sometimes you have to make a little tiny incision behind the earlobe here to access that area.
Well, she has amazing results.
Yeah, she's extremely happy with the results, and the procedure takes just under an hour.
And it's funny because a lot of your patients will get these huge procedures and they'll add neck liposuction on, and they'll be so surprised with the way that they're just so happy with it.
Yeah, it's I find it amazing. We'll do these body lifts and thigh lifts combined, and then secondarily do like an arm lift, arm reduction, chest lift, chest reduction. And we take off in total maybe about 60 pounds combined of those procedures, 60 pounds. And then we do about a 45-minute neck liposuction. And they're most happy about their neck liposuction. Whatever, but it just shows how happy patients can be with this relatively straightforward procedure.
Yeah, and I think it's for a couple reasons. Like, one, we look at our face all the time,
Yeah.
Even neck liposuction can make it look like you lost a lot more weight.
True. When you lose weight, you lose fat from all over your body. But some patients lose fat in more areas than others. Some patients lose it all in the tummy. Some people lose it all in the thighs and the buttock and the breast and then even the face. So every patient's a little bit different in terms of where and how they lose the fat after significant weight loss. Some patients lose it in the neck. Some patients don't.
This is another one of your older female patients. She was in her 60s and also didn't want a neck lift. She was actually open to it, but you told her she could get away with neck lipo, and I think that was a great idea.
Yeah, so this patient was a little bit tricky. Again, she was sort of a double-double. She was weight loss patient and in her 60s. And I suggested to her, let's do neck liposuction first, and if you're not happy with it, we can always come back and do the incision around the ear, behind the ear, and do that formal neck lift if you need it. But fortunately, we did neck liposuction here. We took out a little tiny area of fat, and we made that skin more stickable, and that skin stuck to the lower angle of the fascia just underneath the chin there, and you can see that nice chiseled 90-degree neckline there. And here we have that sort of blunt or obtuse angle from the chin down to the clavicle.
I think neck lipo was an excellent choice here.
Yeah, and she's very happy. Yeah, she does have a couple little teeny tiny wrinkles there, but she's very happy with the results. Did not need a neck lift or a facelift incision. One thing the neck liposuction surgery does not address is the muscle. Again, when we're doing liposuction, we remove fat. Fortunately, when we do the vaser and these neck liposuctions, the skin does stick down to the underlying fascia. So it does sort of tighten the skin with the vaser. It does sort of tighten the skin because it adheres, it sticks down. But neck liposuction does not alter the neck muscle. So if the neck muscle is sagging, then you really have to do a platysmoplasty, that's sewing the muscle together in the neck. When we sew the muscle together, we bring it sort of like the rectus muscle in the tummy, we bring it together and invert it. So we take a suture, running suture typically from the back of the chin there, down to the hyoid bone there, and we plicate or bring in that platysma muscle.
And that's all done through which incision?
That's done through the incision in the chin. Now, they would get in there, we have to make an incision larger than the liposuction cannula.
I don't really see that incision. Can you talk about how painful neck liposuction is?
Neck liposuction is not that painful. I can do these, typically we do these under general anesthesia. Typically we're combining the neck liposuction with another procedure. Maybe we're doing an arm reduction or a breast lift, breast reduction, maybe a back lift. Maybe we're doing a body lift or a thigh lift. But these procedures, neck liposuction, can be combined with other procedures. So under general anesthesia, you do not feel it during the surgery. And after the surgery, there is a little bit of pain, but the tumescent solution has numbing medication in there, which usually lasts for a couple of days. Also, we give you pain pills, but most patients really don't take narcotics for isolated neck liposuction. Most people will take 1 or 2 days of Tylenol if we're just doing isolated neck liposuction.
How long do you wear a garment for?
So every plastic surgeon's protocol is a little bit different. My protocol for neck liposuction is just like this. For the first week, I have you wear that neck garment for 24 hours for the whole week, okay, like all the time. You can take it off to shower, but otherwise the neck garment is on. For the second week, I have you wear it for 12 hours. So you can wear it during the day for 12 hours, or you can wear it at night for 12 hours. I just need it for 12 hours. So after a week and another week of 12 hours on and off, then you're off the garment. If you still have some residual swelling or you want more support in that area, you can continue wearing the neck garment.
How different is recovering from neck lipo than a neck lift?
So neck liposuction recovery is maybe going to be about a week to 10 days. If we do a neck lift through a facelift incision, that recovery is going to be maybe about 2 or 3 weeks, depending on the swelling, the bruising, and the healing from that.
What about final results? When can we expect to see final results from neck lipo?
So everybody is a little bit different. On the smaller neck liposuctions, you should see a result maybe at about 6 to 8 weeks. On the larger, like that older patient right at the beginning of this presentation, her final results are going to take maybe about 12 to 14 weeks once all the swelling has gone down. Basically, the premise is the more fat I have to remove, the more trauma, the longer it takes to heal, the longer the swelling.
So we found this patient on your website, and this was really impressive. This was a neck lift, not
Correct.
neck liposuction. Can you tell us about her?
Correct. So this patient was a little bit older, and she had lost a lot of weight. I think she had lost over 300 pounds. So a lot of weight, a lot of skin elasticity. That skin's really been stretched out. It bounced back quite a lot, but again, she had a lot of excess skin in the neck. So I felt that if we just did neck liposuction, it wouldn't be enough. So what happened during the surgery is we went into surgery, and I told the patient, look, go into surgery, and if neck liposuction is all you need, we'll stop there. But if you need more, we'll continue with the neck lift and the face lift. So we did neck liposuction. I didn't get the skin as tight as I wanted, so I converted it to a neck lift. And to achieve that, we make a little incision in front of the ear here, and back of the ear here, and then dart back into the hairline. And then from that incision, I can go down to here, down to here, down to the neck, little incision in the neck. I plicated, brought together the platysma muscle there, and then was able to lift all that skin up there by redraping that. So if you look in a mirror and you sort of do one of these on your neck, you can see how much neck skin we can get out with a neck and a facelift. And usually we can get you that nice chiseled neckline there. And she's very happy with the results. That turkey gobbler is gone, that excess skin is gone, and I don't think she looks too pulled back, or I don't think she looks too unnatural or Mach 7, as they say.
That little turkey gobbler that was hanging down was mostly skin, right?
Mostly skin, yeah. So on older patients with a massive weight loss, again in this patient, she lost about 300 pounds, the skin is really not going to snap back as well.
And here's our friend who's on YouTube that we did his body lift, thigh lift, gynecomastia. We did everything on him. And he is so happy with his neck liposuction right here.
So we did lots of procedures on this gentleman. And we did a half an hour, maybe 45 minutes on his neck. And of all his procedures, he's very happy about his neck liposuction. All the other areas look fantastic and wonderful, but he's very happy about his neck. So before, he had this sort of obtuse angle from the chin down to the clavicle in there, and so we just did a little bit of liposuction there, removing a little bit of fat in there, making that skin more stickable, and that skin sticks down nicely, and he has a nice chiseled neckline here, 90-degree angle.
How do these scars heal?
Scars heal really well. We place one right behind the chin there at such an angle that you would not even see that scar. If we need to, we'll place an incision behind each earlobe here to get the back of the neck too. And the incisions are about the size of like a pencil eraser or smaller. Usually we leave them open so the fluid can come out. Sometimes we'll close them with dissolvable stitches so the scar markings heal very well, and a lot of the time they just disappear over time. Never completely disappear, but fade very well.
And I know you said you use general anesthesia. Why do you use general anesthesia?
Yeah, so I really like general anesthesia for these procedures because if we're doing it under local or even twilight anesthesia, the patient is awake. And, if you're holding your neck perfectly straight like that for neck liposuction, and if you wake up or jolt during the procedure, there are major structures here laterally like the carotid artery, the jugular veins, and if we get into bleeding on the side there, it can be catastrophic. So I prefer general anesthesia so you're not moving, we're in control of your airway, we can keep you in a perfectly still position, and I can concentrate on lipo in the middle here and on each side and get you a really good result. In my experience, I think general is much safer than local or IV sedation for neck liposuction. So if you're interested in neck liposuction, please give me a call. If you're like, I don't know what to do with my neck, please give me a call and we'll get you in the office and we'll take a look at your neck. We'll see you next week. Thanks for watching.
Katzen.
Thanks.
Bye.
Bye.